For the management of the patient who presents with an obstructing kidney stone, our treatment approach will often depend on where the stone is in its course down the urinary tract. Stones in the kidney and in the upper portion of the ureter, that's the drain tube that carries the urine from the kidney down to the bladder, we will often use what's called ESWL. That stands for extracorporeal shockwave lithotripsy, or what patients typically refer to as the stone blaster. That's technology that comes to town on a tractor-trailer truck. Comes right to the back of Valdez Hospital. It's done obviously with the patient, myself, a registered nurse, and an x-ray technician. We can do it under intravenous sedation. Patient does not require intubation or paralysis or deep anesthesia. It's technology in which we use shock waves, not electrical shocks, if you will, but imagine standing at the edge of a pond. You take a large rock and you throw it into the water. The transfer of energy from that rock to the surface of the water is manifest by the creation of waves. Well, some really smart guys figured out a way to harness the energy of those waves and focus it onto a kidney stone. We can turn a solid stone into pixie dust. Some stones become too large to pass. If we can pulverize that stone into pixie dust, then the patients can pass that with their normal urine flow. We schedule them on the hour. Treatments typically take about 45 minutes. Patient, again, it's in same day, home same day. Larger stones and stones that have made their way further down the ureter, we will often approach with what's called ureteroscopy. That's the use of small fiber optic telescopes inserted through the body's natural openings, the urethra, that we can use to insert into the bladder and then into the opening of the ureter. We basically are doing this under direct x-ray and camera guidance. We basically follow the path of the ureter until we encounter the stone, and then we can ensnare it in a basket and remove it. If it's too large, then we may have to fragment it there, again with a stone blasting technology that we can use in the body. This includes even laser energy. So we'll fragment that stone into pieces and then remove those pieces in a basket. For multiple stones in the kidney or stones typically larger than 2 centimeters, we offer the patient what's called percutaneous nephrostolithotomy. That's basically a fancy term for a controlled approach where we make a small incision and actually go into the kidney itself with small telescopes. Again, there we can fragment stones as necessary and remove them, or remove them in whole with the use of special grasper and basket type devices. So there are many ways to crack the nut of kidney stone disease.